Hey NPs, we know how hard it can be with your busy schedules to stay up to date in your clinical practice and earn your required CE and RX credits. The Nurse Practitioner Podcast is here to help. NCNP On Demand provides access to recorded sessions for 90 days after the live event of Lippincott's National Conference for Nurse Practitioners to allow you ample time to watch and earn credit. Listen from home or on the go, whenever and wherever you can fit talks into your schedule to earn up to 49 CE and 33.5 advanced pharmacology credits. No matter your specialty or setting, NCNP's 30-plus sessions delivered by expert speakers have you covered. Talks tackle clinical guideline updates, best practice advancements, professional development trends, and more across all areas of practice. To learn more and register, visit tnpj.com and click the NCNP tab at the top. In this episode of the Nurse Practitioner Podcast, Dr. Efrat LaMandre discusses brain and gut health. As a public speaker and best-selling author with over 5 million followers on various platforms, Dr. Efrat LaMandre, or Dr. E as everyone calls her, is a medical disruptor, disrupting and reshaping healthcare. She advocates against medical gaslighting and empowers patients to recognize that their symptoms are not in their head. Dr. E has also founded several businesses in the health space, including EG Healthcare for Primary Care, the New Method for Functional Medicine, Hawk Scribes for Medical Scribing, and EG Prep Education for Nurse Practitioners. Passionate about promoting longevity, Dr. E inspires individuals to realize that they can achieve peak performance at any age. She is also a fervent advocate for NPs amplifying their voice in the healthcare arenas. Thanks for joining us today, Dr. E.
Oh, God, it's an honor to be here. I love your voice.
Welcome to our deep dive into the brain's health and its surprising link to our gut. Many of us fear the loss of memory that can come with age. Can you please explain why this fear is more than just forgetting names and dates?
Absolutely. And again, thank you so much for having me. This is such a good topic because I think everyone is terrified of losing their memory as they age. I imagine that you feel this way or listeners feel this way. It just taps into a deep-seated anxiety about losing your sense of self, right? And we all have the image of someone that we know that we've seen that is dealing with this. We see the people who have deteriorated or we've heard of it and we just know that we don't want that. And that's because it's scary, right? Because memory isn't just about recalling facts. It's literally your entire lived experience, remembering what happened to you as a child, remembering your loved ones. And losing your memory affects your ability to connect, to be in the present, to plan for the future. So it's really the cornerstone of our existence, which is why the prospect of it declining can be so terrifying.
Many of us notice occasional forgetfulness or moments of brain fog. Based on your work, can you describe how these might be early indicators of cognitive decline?
Sure. This is a really good one because I don't mean to scare anyone, but I also don't want to underestimate brain fog, right? There's this misconception that brain fog and forgetfulness, they're just par for the course. It's just part of aging. Oh, I'm so busy, I forget things. And there's also a misconception that dementia is just a matter of luck. Maybe it's genetic, maybe it just happened, but neither of those are the case, right? On the one hand, brain fog actually indicates more, and we'll talk about in a second, but also dementia is not actually something that's inevitable. Just because grandma had it doesn't mean you have to have it. And in fact, the brain fog could be warning signs that we really have to start paying attention to because we actually have more power than we realize to change the trajectory of our brain. And all of this comes to fruition when you start to understand that this cognitive decline, it doesn't happen overnight. Okay? It's gradual. It's a creeping process that takes decades to evolve, right? You don't suddenly forget how to tie your shoes. It happens slowly over time. So when the adults come into my office and they're worried about memory lapses or brain fog, it's actually a legitimate concern because it will take years for dementia and Alzheimer's to manifest. And it's important that we take that concern seriously because if you go to a neurologist, you'll pass all the tests. You don't fail the memory test when you first start coming in worried about this concern. So we really have to bring it to light and start understanding that these are early signs. They're like the first clue that points towards the brain not functioning at its best. And if we start recognizing that these minor forgetfulness, these instances can actually be early manifestations of a slow process, then we know that we have to start intervening. Just for statistics, just so we're all on the same page, 1 in 3 seniors dies with Alzheimer's or dementia. That's a huge number. Over 5 million Americans are struggling with Alzheimer's. And, we know that after, right, postmortem, but we know now that we can find some changes in the brain, sometimes 20, 30, or 40 years before the diagnosis of dementia. So that's why it's so important to start taking care of your brain right now in your 30s, your 40s, your 50s. It's not an overreaction. It's actually proactive and necessary.
Okay, so that's pretty scary and a compelling argument for early intervention. But is there actually anything we can do about it?
The short answer is yes. We have an opportunity window to influence our brain long before symptoms appear, right? And this feels like counterintuitive, but let's use what we already know. We know that we can prevent heart disease by living a healthier lifestyle, right? If we eat right, if we exercise, it's all been drilled to our heads. But you need to start thinking of your brain in the same way, right? What can you do right now to prevent Alzheimer's and dementia? It's not a tomorrow problem, it's today problem. Just like you want to prevent that heart attack in the future, that's a today conversation, not after the heart attack. And the science is really clear about this. Aggressive lifestyle intervention can make a difference. And it starts with the same changes that we know for heart and hypertension, right? Adopting a brain healthy diet, low in sugar, high in good stuff, engaging in regular physical movement. It doesn't have to be in high intensity exercise, using your brain in cognitive exercises, sleeping. Oh my goodness, sleeping is so important, and effectively managing your stress. So again, all the things that you know that are bad for your heart, the sugar, the starches, the insulin resistance, it's also bad for your brain. Scientists are now referring to Alzheimer's as type 3 diabetes or diabetes of the brain. I know it's crazy. So the same risk factors, the same lifestyle that gives you diabetes can give you Alzheimer's. And we know that diabetics are 4 times more likely to get dementia than non-diabetics. So we see that connection over and over again. So fixing your brain starts with fixing your body. Remember, it's all connected. You have to optimize the inputs, take out the bad stuff, put in the good stuff. And starting early is key. You don't want to just wait for the decline to happen, although it can help even when you're having this. But when we're talking about declining, we don't just mean memory, all of it, right? If you have anxiety, depression, personality disorders, mood disorders, eating disorders, addictions, and OCD, ADHD, all of this, believe it or not, we're so used to thinking of it as a brain issue, but it's a body issue, and all of it can be addressed with lifestyle treatment. I'm not suggesting that we shouldn't take medication. I'm just saying there's another component to it. And another thing that I want to just bring to our audience is that if we could start thinking of our brain like a bank account where our habits are deposited, so they're either being deposited or we're withdrawing. So we want to deposit a healthy lifestyle and limit the withdrawals like stress and poor diet because we're investing in our brain's future. With every positive choice, every positive deposit, you're not trying to make it like, oh, I hope I hit the jackpot. You really want to start focusing on saving your brain for the future. And as I said earlier, this is a today issue to solve a tomorrow problem. And the earlier we get to it, the better. But that being said, it's never too late. You could start making changes right now.
So, if cognitive decline isn't just the luck of the draw, what factors are at play here?
So that's an excellent question, right? Some people assume that it's just your genes. My grandma had dementia, I'm going to get it. So it's your genes, but not exactly just your genes, right? Genes gives you a predisposition, but you actually have to turn on the genes in order for them to be expressed. Let's think of diabetes because this is something everyone is familiar with. So grandma had diabetes, grandpa had diabetes, your aunt has diabetes. Does that mean you're definitely going to get diabetes? No, you still have to eat the sugar. You still have to eat the bread. Now, you're more likely to get diabetes with sugar compared to your neighbor who doesn't have the gene, who can eat sugar all day long and maybe not get diabetes. But you still have to bring in that lifestyle to turn on the diabetes gene and then express the disease of diabetes. So when you have the gene, it predisposes you, right? It loads the gun, but the environment pulls the trigger. And by environment, that also mean your lifestyle. So all of that is true for memory and for Alzheimer's and dementia. You can have it in your family, but it doesn't mean you're destined to have this issue, right? Because if you're destined, it's like, everyone you just give up now, right? Then that's not the case. When it comes to cognitive decline, there's a few players. Yes, it's your genes, but it's also your lifestyle choices, your environmental factors, what you're exposed to, And of course, the gut, which I know we're going to talk about. The gut is a key player in this scenario regarding our brain health.
Can you please tell us a little bit more about this gut brain connection?
This is a big thing that's often overlooked. We tend to think of all our body parts separately because we go to different doctors for different things. You go to the neurologist for one thing, you go to the nephrologist for another thing. We forget that things are connected. It's all in one vessel. So the brain and the gut are constantly communicating, constantly, all day long. They're physically connected with the vagus nerve, and they're also chemically connected through the microbiome. And we'll go into details about that. So I just first want to get this understanding that they are connected. And if they're constantly talking to each other, right, in an oversimplified way, we can understand that if your gut isn't happy or healthy, then your brain is not going to be happy or healthy.
This link between the gut and the brain is quite intriguing, but how exactly can the gut influence something as complex as our brain function?
Love that. Actually, the gut is often called the second brain. Well, let's talk about that connection. The first is physically connected with a nerve. You have the vagus nerve. It's the longest nerve in the body. It runs from the brainstem to the abdomen. And so they're literally connected. There's a highway of information that's constantly talking between brain and belly. So think of the things you already know. You smell food, your seafood. That's happening up here. And yet it triggers your digestive enzymes. That's a conversation. And when you eat food, it goes here, but yet it signals to the brain that, hey, we're full. When we feel stress, right? Your brain feels the stress, but you know that feeling you get in your stomach, whether it's butterflies or intensity. Some people eat more, some people eat less. That's a conversation. And if your gut is inflamed and a mess, it could also send signals again up this highway, this vagus nerve highway, that can release stress hormones. So if my belly hurts, I'm going to release more stress hormones. So there's this constant conversation that we are aware of and we know what's happening, but many of us didn't think about how they are connected. But that's just the tip of the iceberg. Your gut actually affects your entire nervous system, right? We all know about the sympathetic and parasympathetic, like basically, not a big deal, but they just automate everything, right? Your heart rate, your breathing, your digestion, your fight or flight, your rest and digest. All of it is actually connected to your gut. Your brain, your nervous system, all of it is happening through your gut. And your vagus nerve is essentially like a commander in chief when it comes to controlling your central nervous system. It tells it when to rest and digest. It tells it when to increase respiratory rate and heart rate. So it is in charge of so much more. We're saying gut brain, and that seems oversimplified. It's gut brain central nervous system. It constantly relays messages from the brain to the gut about incoming stress, when to relax, as I said earlier, when to redirect blood flow. So when we talk about the gut influencing mood and cognitive function, the vagus nerve is the central player. It regulates, we're going to talk in a moment about the microbiome, but in your belly is where neurotransmitters are produced. It produces serotonin and produces dopamine. I know it's crazy. Most of us think the serotonin and dopamine is in the brain because that's where we think, it all happens, but it's actually produced in your belly. 90% of your body's serotonin is found in the gut, right? So again, when we're talking about mood, we're talking anxiety and depression, we're talking about belly. And this vagus nerve that connects, it, is sending the signaling and sending the neurotransmitters up and down, literally controlling our mood, anxiety, our stress level. By the way, vagus nerves, just a little side, this is why a deep breath works, right? Like, I'm taking a moment, and I always do this in the middle of a podcast, and I kind of recenter myself as I do it because I start talking excitedly. But the reason that works, that deep breath works, is because it stimulates your vagus nerve, which sends a signal to calm down, lower the heart rate, lower the blood pressure. All I did was stimulate my vagus nerve through my diaphragm right here in the center, and all of a sudden I'm calmer. And that's just a prime example of how interconnected the gut and the brain are.
Wow, they're physically connected. How else do the gut and brain talk to each other?
So that is a great question. We just talked about the vagus nerve connecting physically, but we have to talk about the gut microbiome. And if you want more information about the gut microbiome, I really go into depth on this on my YouTube channel named after me, Dr. Efrat LaMandre. If this interests you, I have so much information out there. But here's the Cliff Notes version. The gut microbiome is made up of trillions of microorganisms, bacteria, virus, fungi. They all live there. Your belly is not sterile. It's a hot mess. And we want it to be a hot mess. You want it to be this bustling city of microorganisms, because these microorganisms, they don't just live there. They produce the things we need to stay alive. Again, as I mentioned earlier, dopamine, serotonin, GABA, neurotransmitters that are in charge of our mood, our appetite, our sleep. They are all produced in the belly, right? It's the bacteria in the belly that make them. If you don't have the right bacteria, they're not going to make those. So if your gut microbiome is imbalanced, it leads to changes in creating dopamine, serotonin, and GABA. It's a really big deal. That's why a lot of times probiotics is something that's used for anxiety and depression, because it's about getting the microbiome right. So you want to make sure you have a certain amount of good bacteria, not too much of the bad bacteria. And again, as I said, very targeted probiotics are really helping in anxiety and depression. Study after study is showing that. Now, here's another way how microbiome affects your health. There is something called the blood-brain barrier. We're all familiar with it, right? It's the barrier, the protective barrier that separates your brain from harmful substances. And we have to remember, like everything we eat, we're actually bringing the external world right into our belly. And so we want to make sure there's some sort of barrier. If we just pick something up accidentally, that's not going directly to our brain. We don't want that. But when the gut microbiome is imbalanced, it can lead to something called leaky gut. Fancy word for that is increased permeability. And that can actually allow harmful substances to enter the brain and cause inflammation, right? And what is inflammation? Inflammation of the brain is something as little as brain fog, but also as severe as multiple sclerosis, Parkinson's, Alzheimer's. And we know, in fact, that people with MS and Parkinson's, Alzheimer's actually have a disrupted gut microbiome. So it's like this loop. You have this gut microbiome that's messed up. It can cause inflammation of the brain, and the inflammation of the brain in turn can send this messaging, and you can get really in a loop of, what do you heal first? But all of it has to do with your belly allowing, as a leaky gut, this increased permeability, allowing things to go into your blood-brain barrier. So we talked about the neurotransmitters being made in your belly. We talked about leaky gut, intestinal increased permeability. But now we want to talk about the relationship between stress and the microbiome, right? Remember, microbiome, we want more of good, less of bad, and we want it to be a nice balance of microorganisms in our belly. If we're stressed, it can actually affect that imbalance. That stress can cause the good bacteria to diminish and the bad bacteria to go up. And we just said, if we have that imbalance, that is going to affect our mental health. So that's one direction, right? The stress affecting the microbiome. But in the other direction, if you already have an imbalanced microbiome, it can go upward and lead to chronic stress and anxiety. So the point is that one drives the other. You want to make sure your microbiome is balanced so that it can send good signals upstream. And you want to make sure that your stress is managed so that you can send good signals downstream and keep that microbiome healthy. Now, this is a whole new way of understanding how the gut and the brain work. So the gut microbiome is not its own ecosystem that happens to live inside of us. This ecosystem of these bacteria and these microorganisms that live with us, they're actually an integral part of our cognitive well-being. So when we say take care of your gut, we're not just talking about make sure you don't have acid reflux, make sure your belly's, like your digestion's okay. We're actually talking about creating a good environment for your brain so that you have clear thinking, emotional resilience, no brain fog, and down the road, preventing dementia and Alzheimer's.
Okay, we now understand that there is a gut-brain connection. But how do our choices affect this connection?
So for this question, I need to introduce you to a new word called dementogen. Okay, and dementogens are not the ghosts from Harry Potter. Dementogens are things that cause dementia, things that damage our brain. Now, some of these things might be obvious, but some of these things are not so obvious. So let's talk about that. Nutrition. Okay, if you're eating the standard American diet, if you're listening from Canada, the standard Canadian diet, the standard Australian diet, insert all the standard diets here, you're basically consuming an inflammatory diet. The food that you're eating is highly likely to be very inflammatory. And now we understand that this inflammation travels upward to our brain. So an inflammatory diet is a dementogen. Processed food, sugar, starch, food that lacks protective nutrients. These are dementogen. So when you start thinking of your nutrition, Go away from calories, go away from trying to lose weight, and start thinking, is this bite going to heal my brain, or is this bite going to be a dementogen? It's a whole different way of seeing your food. This brings us back to our gut microbiome because we want to make sure that your gut is healthy. So if you're walking around all the time bloated, acid reflux, a lot of gas, then your gut microbiome is not healthy and your belly is in a constant state of inflammation. You're going to really want to address that because that inflammation doesn't just stay in your belly, it travels and it can travel to your brain as well. Remember, inflammation doesn't stay in one place. Lack of movement. Lack of movement is a dementogen. When you move, and I'm purposely not saying the word exercise because I find that sometimes to be off-putting. I just want you to move. I want you to get up and walk around the block. I want you to get up and, check your mail a few times, whatever it takes. But when you move, you actually release a chemical called BDNF, brain-derived neurotrophic factor. And what it does is it's basically miracle grow for your brain. It gets your brain going, gets your spinal cord going, and that only happens when we move, right? So lack of it means we have a lack of BDNF, and lack of movement is a dementogen. So again, don't think of, I need to go to the gym because I need to lose weight, I need to fit into a dress. I want you to say, I'm going to start moving to protect my brain. It's a whole different way of looking at it. This one is bananas. Lack of sleep is a dementogen. In fact, this sentence always makes me crazy. Lack of sleep is causative for dementia. It's not correlative, it's causative. Lack of sleep over time is causative for dementia. And that's because at night, your brain has to do a big cleanup, right? The sanitation department is supposed to come in and kind of clear out this metabolic waste. There is a system called the glymphatic system. It's not the lymphatic system, it's a glymphatic system. It's basically kind of like the lymph system for your brain. And as I said, this is the at nighttime, the nighttime crew comes out and gets rid of all this waste. And if you're not sleeping, then that waste builds up. And that waste buildup will have an effect over time, right? You know what it feels like when you just don't sleep well and you're not optimal. You don't want to take a test when you didn't sleep well. You don't want to go to a job interview when you didn't sleep well, right? That's because you didn't get an opportunity to really clean out, to really restore. If that happens night after night after night after night, it has a cumulative effect. So start thinking of lack of sleep as a dementogen, and it really changes how you prioritize your sleep. Stress is a dementogen. Now, again, we all have stressful lives. It's not possible. I'm not telling you that everybody has to go hug a tree, although it's lovely to do that, especially if you're in a national park. But constant stress is a dementogen because when your cortisol levels are consistently high all the time, every day, all day, it literally shrinks your brain. It could affect two areas of your brain. I don't want to get too technical in it, but just trust me on this one. Stress is a dementogen, and that doesn't mean that you can never have stress. It just means you really need to spend some time learning how to manage stress, whether it's as easy as what I did earlier, which is to take a deep breath, or to go to therapy, or just take a moment, whatever it takes to help mitigate that stress is really important. Next on the list for dementogens are toxins. So what are we exposed to all the time? Are we exposed to secondhand smoke all the time? Are we around mold all the time? Is there heavy metals around us? Are we constantly around plastics? What are we putting on our skin? What are we putting on our faces? What are we putting on our hair? These all add up and can be part of the dementogen picture. Lack of relationships is a dementogen because we need to have social connections. These social connections, these social interactions actually feed and grow our brain. COVID wasn't so long ago. We know that there was a mental health crisis in this country as a result of a lack of social interaction. So imagine a lifetime of that. What will that do to the brain? So really going out there and connecting is so important for your brain. And then last on our list, right, are infections. Many of us have underlying infections. Maybe it's in our teeth. Maybe we're not taking care of our teeth. Maybe we have H. pylori in our belly we're not taking care of. Maybe we have chronic Lyme that we've never diagnosed. But sometimes we have these underlying infections that we're not catching, which creates inflammation. So just like recapping it all, like our nutrition, our sleep, our microbiome, our movement, our stress, our toxins, our infections, and our relationships. These are identifiable, measurable things that we can do every day that literally can make a difference of what our brain is going to look like as we age.
So, what do we do to avoid these dementagens?
So what we do is, now that we recognize what they are, we want to try to reverse it, right? So when it comes to nutrition, and I can't tell you how many of patients, clients that come to me because they're having trouble with cognition, brain fog, focus, forgetting. And as soon as I clean up their nutrition, I get them off of inflammatory foods, right? I haven't done anything. I haven't put them on any medications. I just clean up their diet, get them off the sugar, the gluten, the dairy, which are like the big ones, the artificial foods. They tell me time and again, oh my God, my brain fog has lifted. And they can feel the moment when the brain fog is gone. And this is because we have to think of our nutrition. Food is medicine. It's not like medicine, it is medicine. And think of the things that you put into your mouth. Every single thing you put into your mouth breaks down into code. So you write like a computer code. So if you take a medication, it breaks down into code that tells your cell something. If you eat broccoli, it breaks down into code that tells your brain something. So when you look at nutrition, I'm really trying to steer people away from thinking about nutrition for diet or for body image. Start thinking of your nutrition as your code, and you start understanding that you choose to eat certain codes, a healthy, balanced diet, right? Then you start understanding that the food that you eat is truly medicine and it can actually affect your brain. So we want to avoid the things that can harm the gut, such as antibiotics if we don't need it, processed foods, right? Whatever NSAIDs if we don't need it. These are things that can really disrupt our gut. And we want to start putting in the quality, healthy nutrients so that we can really reduce inflammation. The next thing we have to do, and I said that earlier, is you have to move, right? You have to move. We just said that exercise is a great way to build BDNF, the brain-derived neurotrophic factor, but it's also a great way to consistently oxygenate. You want to oxygenate because that really helps build your mitochondria. Mitochondria, real quick, high school biology. Mitochondria is the powerhouse of the cell, and you want to constantly make sure that it is in its best possible shape. When our mitochondria decline, that is when we decline, and movement helps the mitochondria. I think I told you guys about sleep. I think I drove it home. Lack of sleep is causative for dementia. You want to shoot for 7 to 9 solid hours a night. I know that's hard for people, but the first step is prioritizing it, right? So putting away the emails, putting away the phones, doing what you have to do to really prioritize getting sleep, taking the melatonin or if you need it, fixing the sleep apnea, whatever it takes. Instead of saying, oh, it's fine, whatever, some people say, I'll sleep when I'm dead, or, it doesn't matter if you're tired. Or some people erroneously say the early bird catches the worm and will actually wake themselves up really early in an attempt to go exercise or something like that. But once you start realizing how important sleep is for your brain, you change the priorities. So you want to put that in there. I think we discussed stress as well. It's not about not having stress, but it's really about mitigating stress. For some people, it's meditation. For some people, it's just a deep breath. But I just want to put out there that meditation studies have shown that just 3 months of meditation, you actually see structural changes in the brain. Structural changes in the brain. I don't know a single other intervention that changes the brain positively. So 3 months of meditation does that for you. Of course, toxins, if you think you're exposed, if you're working in a building that constantly makes you sick every time you walk in, that's going to affect your brain. Go get tested and then find a guide to help you detox. And if you're thinking you have an infection, same thing here. Social networking, make sure you have them. If it's not your family and friends, join a group. I just saw on TikTok earlier today that there's a group of women every Sunday at 12 o'clock who meet in Manhattan just to walk together. Because then it's like, if you don't know anyone in Manhattan, just come walk. There are so many groups out there. Join them. Push yourself out of your comfort zone. It's so easy to be like, no, I don't feel like getting dressed. Let me stay home. Push yourself now with the understanding that it's good for your brain.
We hear so many things about supplements that are good for the brain. What's your take on this?
I love supplements as long as we understand they're supplemental, right? So it's not instead of nutrition, oh, yes, I'm going to eat, my hamburger and fries every day, and then I'm going to go out to get supplements. That's not really going to work. You want the supplements to be kind of part of this complete breakfast. And in that respect, I love supplements because it's very hard to get everything from nutrition. You would have to be like your full-time job to make sure you have enough of this and enough of that. And that's hard to do. So you want to start with a really good, solid base of nutrition, and then you add supplements on top of it. And there's like a million supplements in the world. And, some people take 30 supplements. So you want to target the supplements for your goal. If your goal is brain, then some supplements that are really good for that, omega-3. Omega-3, especially from fish oil, if you're not ethically opposed, is amazing for brain. It's like, oil for the Tin Man. It helps reduce inflammation, and it really is shown to have a preventative role in dementia. And if you can get a B complex, because B6, B12, folic acids, again, have been shown to have an effect on cognitive decline with Alzheimer's disease. Vitamin D. Vitamin D, I don't have a single segment on any topic that I talk about that I don't also include vitamin D. Vitamin D is linked to cognitive function. It's not just your bones. It's not just your teeth. It is so much more. Vitamin D is a really big issue. And when you have a decreased vitamin D, you have an increased risk of cognitive decline. And then vitamin E, which is an antioxidant. And that has also been shown to protect your brain. There's also a class of supplements that I think we should talk about in this segment for brain, and they're called nootropics. And nootropics are compounds, supplements, or foods that increase brain power and function. Okay, a very common nootropic that we are all familiar with is caffeine. There's a reason why you wake up in the morning, you're like, oh, don't talk to me until I have my coffee. And then you have your coffee. That caffeine is a substance that you're taking in, and it enhances your cognition, enhances your memory, it wakes you up, enhances your brain power. So it's not just caffeine that does that. There are other kind of nootropics out there. I like to bring caffeine in because everyone can relate to that story, that morning cup of coffee or tea that you have in the morning. It's happening because it's a nootropic. So L-theanine is another compound that can enhance your brain power. And it's been shown to be just as effective as caffeine, but without the jitteriness. So that's something to consider. There's supplements in there, but it's also found in green tea. The next compound that you could consider is huperzine A, because what huperzine A does is it increases the amount of acetylcholine in your brain. And acetylcholine is a neurostimulator, right? It wakes you up and it improves your cognitive ability. So we have caffeine, L-theanine, huperzine A. They all work, but remember, they give temporary effects. You know how long that coffee lasts. They raise the chemicals for a short period of time, and then they probably bring you back to baseline. But they are natural, and using them as part of your overall journey can be helpful. Just as a side note, as I said earlier about all supplements, you don't want to run and just live on caffeine, L-theanine, and huperzine A, and meanwhile you're out here every day eating ice cream and pizza, right? Always do the lifestyle measures first, fix the nutrition, get to sleep, get moving, remove the toxin, and then you could add this on top of it. So in summary, I really want to thank you and your audience for your time. I just want to let everybody know it is not too late to jump in the game. Jump in the game, make the changes. You don't have to make all of them. Make one change at a time. And I'm sure that you will get to where you want to be on this journey.
Awesome. Thanks so much for your time today, Dr. E.
It's my pleasure.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at the Nurse Practitioner Journal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.